What is the difference between a submuscular breast implant placement and a dual plane breast implant? These are two completely different procedures. Unfortunately, many plastic surgeons confuse between the two. And when they are telling the patient, they will say they do dual plane, but in actuality, they will be actually doing the submuscular. So today, I'm going to take this opportunity to explain the differences between the two. Finally, you will realize why dual plane is much better than the submuscular approach. The submuscular approach is an older concept. People have been doing it for years, maybe decades. And the dual plane is a more recent approach. And this is the preferred technique in most of United States of America. Most of Great Britain does the dual plane, and at least half of Europe does the dual plane. So let's understand how we do it. So if you look here, I've drawn a picture of the breast. The incision is just below the breast, the inframammary approach, the inframammary fold incision that is done. So first I will explain the submuscular approach. So here we go down, we make the dissection. This is the muscle, the pectoralis muscle. We cut the muscle here like this, go under the muscle. Suppose this is the muscle, go under the muscle like this and put the implant like this. The muscle does not move up. The muscle stays here. The breast does not move up. It stays here. The implant moves up, and for at least 3 to 4 months, the implant actually stays very high up because the muscle is not moving up at all. And as we push, the implant makes space and moves up. After some time, the implant comes down and then takes a more normal shape. Now, what is the dual plane technique? So let me now try to explain to you what is a dual plane procedure. In the dual plane technique, again, the incision is in the inframammary fold here. We first raise the breast tissue. We go like this under the breast but above the muscle. So like this, we raise the muscle till raise the breast till here, till this point. What happens is the breast actually gets free to move up. Then we make a cut like this, like this. The muscle not only moves like this, it actually moves like this. Once the muscle moves like this, the implant comes here. The muscle covers the implant in half the direction. The whole breast moves up like this. After a few months, it gradually takes a more normal shape, but the implant does not go too high and it gives a very nice upper pole fullness. The breast also moves inwards like this and gives more fullness on the inner side as well. None of that happens with the muscular approach, the submuscular approach. So the advantages of the dual plane are better upper pole, better inner pole. The breast actually moves up, so mild sagging can also be taken care of. You actually get a better cleavage with the dual plane technique. So today, in my opinion, submuscular approach has zero role, absolutely zero role. Either a subfacial technique is done where the implant is placed sort of just above the muscle, or the dual plane technique. There is no third approach which today matches the results of these two techniques.